Dengue and other Aedes-borne diseases such as chikungunya and Zika pose a significant threat to global health, affecting 129 countries and putting over 4 billion people at risk. In 2019, the Americas experienced an unprecedented dengue outbreak, with more than 3.1 million cases and over 1,500 deaths. Dengue epidemics often follow seasonal patterns, peaking during and after rainy seasons due to factors like high mosquito populations, favorable temperatures, and increased humidity. These conditions boost mosquito reproduction and virus transmission. Even in 2020, dengue continues to impact many countries, with over 1.4 million cases reported by May. As the COVID-19 pandemic strains healthcare systems, the risk of overlapping outbreaks becomes a serious concern, making dengue prevention and control more critical than ever. With healthcare resources stretched by COVID-19, countries must use their assets wisely to prevent and control dengue. Integrated surveillance remains essential. Monitoring and reporting suspected and confirmed dengue cases helps target hotspots for intensive vector control. Surveillance networks can expand their criteria to include COVID-19 symptoms, maximizing efficiency. Diagnostics are also crucial. While both dengue and COVID-19 use PCR tests, they require different samples and reagents. Serological tests rarely cross-react, but strengthening laboratory capacity is vital. In malaria-endemic areas, blood smears should rule out malaria. For case management, early diagnosis and recognition of severe dengue warning signs are key to preventing complications and reducing hospital overload. Hospitals must be ready for severe cases, and protocols should address co-circulating diseases. Infection prevention measures like hand hygiene and PPE protect both patients and healthcare workers. Effective vector control is at the heart of dengue prevention, especially during the COVID-19 pandemic. Households should regularly eliminate stagnant water, reduce solid waste, and cover water storage containers, simple actions that can be done weekly even during lockdowns. In areas without restrictions, vector control teams should target both larvae and adult mosquitoes, using PPE and maintaining social distancing. Vulnerable groups like the elderly, pregnant women, and infants should use insect repellents. Additional measures such as larvicides and indoor spraying can be tailored to local needs. Community involvement is crucial. Media campaigns, school awareness sessions, and local initiatives help spread prevention messages. By working together, communities can reduce mosquito breeding sites and lower dengue risk, even as they protect themselves from COVID-19. The simultaneous occurrence of dengue and COVID-19 outbreaks presents unique challenges for healthcare systems and communities. Both diseases can cluster in the same areas and share overlapping symptoms, increasing the risk of misdiagnosis and complicating case management. Co-infections are possible, making it even more important to strengthen surveillance, diagnostics, and clinical protocols. Lowering mosquito populations before the rainy season is a key strategy to reduce dengue cases during peak periods. Ultimately, coordinated efforts across health sectors, communities, and local authorities are essential to minimize the impact of both diseases and protect at-risk populations.